Okay, let's dive into this. Welcome to today's Explainer, where we're tackling a critical medical emergency that, honestly, we all need to understand. Appendicitis. We are going to map out the entire patient journey today. I'm talking everything from those very first sneaky warning signs, all the way through to long-term recovery and healing your gut. Because when it comes to this condition, timing is absolutely everything. Knowing exactly what to look for could quite literally save your life, or for sure, the life of someone you love.
Now, you might be wondering, why does this matter to me right now? Well, check out this staggering number, 1 in 20. That means 1 in every 20 individuals will experience appendicitis at some point in their lifetime. In the US alone, we're looking at about 250,000 cases every single year. It's so notoriously common that even astronauts heading up to the International Space Station have very specific medical contingency plans just in case it strikes while they're in orbit. No way, right? It can strike at any age, though it heavily targets teenagers and young adults, and actually, men have a slightly higher risk than women. So the odds are incredibly high that you or someone close to you will face this exact medical crisis.
So, here is our roadmap for the Explainer today. We'll start with what appendicitis actually is, then walk through the ticking clock symptoms, compared to other conditions, look at immediate surgical treatments, and finally, wrap up with functional medicine and recovery. Let's get into it.
Starting off with Section 1. What is appendicitis? Let's take a look at the anatomy.
To really grasp the severity of this emergency, we first need to understand what is physically happening inside your body. The appendix itself is this tiny, finger-like pouch connected to the very beginning of your large intestine, tucked right down on the lower right side of your belly. Historically, people thought it was just a useless organ, but scientists now believe it's actually tied to our gut immunity. The real crisis begins when this little pouch gets blocked. When that happens, the bacteria that normally just hang out inside the appendix suddenly multiply at a rapid rate. This leads to massive inflammation, severe swelling, and a really dangerous buildup of pressure and pus. If it's ignored, well, the swollen organ can actually burst, spilling all those infectious contents directly into the abdominal cavity, causing a deadly infection called peritonitis.
So what causes the blockage in the first place? Well, in about 30 to 40% of cases, the culprit is something called a fecalith. Basically, this is a rock-like, solid lump of feces that gets stuck and completely obstructs the narrow opening of the appendix tube. Sounds rough, right? But that is not the only cause. The opening can also be blocked by swollen lymphoid tissue, which is often just your body reacting to a viral or bacterial infection somewhere else. Or, in much rarer cases, it can even be blocked by tumors or foreign objects.
Moving right along to Section 2, the ticking clock symptoms, recognizing the escalation.
You see, appendicitis doesn't just happen all at once out of nowhere. It escalates. Recognizing this sort of medical thriller arc is absolutely vital to getting treatment before a dangerous rupture happens. And this brilliantly illustrates that classic sequential progression of an attack. It almost always kicks off with a vague, hard-to-pinpoint abdominal pain, usually right around your belly button. Next, you lose your appetite entirely. That's usually followed by nausea and, in many cases, vomiting. Finally, a low-grade fever sets in, typically hovering right between 99 and 100 degrees. Over the course of just a few hours, that vague belly button pain migrates down to your lower right abdomen and becomes incredibly severe. It becomes constant. And it actually gets way worse if you cough, move, or even take a bumpy car ride. Your abdomen might even become rigid to the touch because your muscles are instinctively contracting to guard that swollen organ.
Now, we absolutely must talk about the worst-case scenario, a burst appendix. If you're experiencing that intense lower right pain and then suddenly feel a strange, rapid sense of relief, do not celebrate. Seriously, that sudden relief is often a massive warning sign that the appendix has just ruptured and released all that built-up pressure. This temporary relief is quickly followed by severe pain that spreads entirely across your whole abdomen, along with a high fever, chills, and a rapid heartbeat. This is a life-threatening emergency. It means you need to call 911 instantly.
Okay, Section 3. Appendicitis versus other conditions. Knowing the difference.
A lot of people actually delay going to the hospital because they confuse appendicitis with severe indigestion or just a bad stomach bug. So we want to empower you to know the difference. Now, what's really interesting about this slide is how stark the contrasts are, so you know exactly what to look for. While the appendicitis presents as that lower right pain that worsens with movement and usually brings a fever, gallbladder problems are entirely different. Gallbladder pain is typically felt in the upper right abdomen, it might radiate to your back, and it's very often triggered right after eating a heavy, fatty meal. So it's a completely different neighborhood in your body and a totally different trigger.
But what about kidney stones? Well, remember, appendicitis pain is constant. It just gets worse and worse after its characteristic migration from the belly button. Kidney stone pain, on the other hand, is severe and cramping, but it comes in these distinct waves, often radiating down into the groin and usually brings along urinary symptoms. Similarly, if it's a UTI, that primarily causes burning and frequent urination. Or an ovarian cyst might cause pain on either side of the lower abdomen that tracks with a menstrual cycle. Appendicitis is uniquely constant. It sits in the lower right, and it is distinctly migratory.
Let's quickly rapid fire through some dangerous myths. You might be wondering, hey, did my diet cause this, or is it genetic? First off, genetics only play about a 30% role. If a close relative had it, sure, you're at a slightly higher risk, but it's not strictly hereditary. Second, stress does not cause appendicitis. It is a physical blockage, not a psychological one. And finally, that old wives' tale that eating fruit seeds or popcorn kernels will block your appendix, yeah, that is a complete myth. Specific foods do not cause this blockage.
Let's transition to Section 4 and dial the urgency down a bit. Surgery and immediate treatment, the critical intervention.
Okay, taking a deep breath here. The clock is ticked, the diagnosis is confirmed, and the simple truth is that appendicitis does not just go away on its own. An appendectomy, which is the surgical removal of the appendix, is the absolute only permanent treatment. Today, surgeons generally use one of two main approaches. The first is laparoscopy. This is definitely the preferred method for most cases. The surgeon makes tiny holes, uses a camera, and removes the organ. Recovery is pretty quick, usually just 1 to 3 weeks. The second option is an open appendectomy. This requires a larger midline incision and is absolutely mandatory if the appendix is already burst or if laparoscopic surgery just isn't viable for some reason. Because it's a bit more invasive, recovery takes longer, usually around 4 to 6 weeks. Oh, and both methods will definitely involve antibiotics to clear out any lingering infection.
Finally, Section 5, Functional Medicine and Recovery, Healing the Gut. Once the surgery is done, the acute crisis is over. But true health is about a whole lot more than just surviving an emergency, right? Let's move to and see how this builds out a really reassuring post-surgery recovery timeline. The first 24 to 48 hours are all about hospital monitoring, managing your pain, and slowly introducing fluids. By the first week, you're doing light activities and modifying your diet. Between 2 and 4 weeks, you can slowly return to normal, non-strenuous stuff, like maybe heading back to a desk job. And by 4 to 6 weeks, most patients are fully recovered, the wounds have healed, and they're cleared for physical labor and sports.
What happens next is incredibly important. So, the crucial point is that a functional medicine approach doesn't just stop at removing the appendix. It looks at your whole body. It aims to find the root causes of any underlying gut irritation or food sensitivities that might have contributed to poor digestion in the first place. Practitioners use advanced testing to actually look at your gut bacteria and inflammation levels. From there, they craft highly personalized diet plans, often using specific probiotics and herbs to naturally lower inflammation, boost your immunity, and ultimately lower your risk of future digestive issues.
Now, while you can't guarantee you'll never get appendicitis, dietary habits play a huge role in your overall gut health. Diets that are low in fiber can lead to harder stool, which, as we learned earlier, can form those problematic blockages. To promote really healthy bowel movements, a proactive diet needs to include high-fiber foods. We're talking whole grains like oats and quinoa, fresh fruits like apples and berries, plenty of leafy green vegetables, and legumes like lentils and beans. And hydration is incredibly important here too, just to keep the whole digestive system moving smoothly.
We have covered the anatomy, the ticking clock symptoms, the surgical interventions, and the holistic path to long-term recovery. But you know, knowledge is only powerful if you actually act on it. So I leave you with this question. Are you paying attention to the urgent signals your gut might be sending you today? Your body is incredibly smart. If you ever feel that distinct, migrating pain settling into your lower right abdomen, please don't just write it off as a stomachache. Listen to your body, empower yourself with this knowledge, and don't hesitate to seek immediate medical help. Thanks for joining me on this explainer, and stay healthy out there.